my name is Beata and I am an NP student. Today I am presented with an urgent appointment of a 26-year-old Indigenous female that came to the clinic because of a 3-day history of abdomen pain. She states the abdomen pain is around 3 out of 10, dull and constant. However, yesterday morning after her first void, stated the pain increased to 6 out of 10, constant, dull, and located more to the suprapubic area, as well as radiating to her back. She also has urinary complaints of increased urgency, increased frequency, not being able to fully empty her bladder, as well as dysuria. She states that her urine does also look cloudy and denies any foul smell or as well as any hematuria. She does take Tylenol, PRN, every 4 hours since yesterday, 650 milligrams, but she says that she has not had any relief from that. She also has a peri bottle that she's been using with just water, that she's been trying to dilute her urine, thinking that it'll help with her dysuria, but also no relief from that. Generally, she doesn't know if she had any fever. She doesn't have a thermometer at home, but thinks that she did have chills last night. She also has no complaints of fatigue, no recent weight loss, no vaginal discharge, no painful intercourse, doesn't feel weak or dizzy or lightheaded, denies any shortness of breath or chest pain, denies any nausea, vomiting, diarrhea, or stool changes, and no blood in stool as well. Her last menstrual period was 2 weeks ago, and she said it was normal, approximately 3 days, and that's how she's been getting it since the IUD insertion. She denies incontinence, no vaginal lesions or warts or redness to the area as well. So she did have history. She noted that in 2020, she had cystitis and she was treated with Macrobid. Her family history, so her dad and mom suffer from diabetes type 2, but also her mom has history of recurrent cystitis. So for her social life, she does not drink. She works full time. She smokes cigarettes around 4 a day. She doesn't use any drugs. She just has one partner for around 5 years now. She does not use any condoms. She has oral as well as vaginal intercourse around 4 times a week. And her partner has no symptoms at all. As per her hygiene, she states that she has good hygiene. She does douche once a week as well. And she wasn't around any sick contacts. Her current medication is just the Tylenol, multivitamins, as well as vitamin D, and she did have an IUD inserted in 2018. And no issues with that. She doesn't have any allergies. Her immunizations is up to date. She did have her COVID vaccines. So as for my assessment, I feel like patient looks well. She doesn't look in any distress, although she is a little bit flushed, but there's no diaphoresis, and she does match her age. As her vital signs, so her blood pressure was 119/79, heart rate was 97, respiratory was 16, temperature was 36.4, oxygen was 99% room air, and her glucose was 5.5. She does have a BMI of 25. I did a urine beta on her and it was negative, as well as a midstream urine dip, and it did show leukocytes as well as some nitrates. Otherwise, there was no blood and everything else was unremarkable. She didn't have any conjunctivitis, no oral lesions noted, good air entry, no shortness of breath, S1, S2 present, no murmur noted or any abnormal sounds. Cap refill was less than 2 seconds. Her Abdomen is symmetrical and flat. Her bowel sounds are normal active in all four quadrants. Her abdomen is soft, no masses were noted, no distension, no rebound tenderness or rigidity. She did have a negative Murphy signs. As for her urinary, she had no inguinal nodes or swelling noted, no tenderness to the there was tenderness to the suprapubic region on palpation, but no bladder distension. And she does also have mild CVA tenderness as well as flank pain. No enlarged kidneys noted. Her skin is warm to touch as well as dry, and no skin rashes or lesions. So I did provide her with some education on non-pharmaceutical things she can do, interventions that she can do, like good hygiene, avoiding douches, and avoiding after intercourse just to prevent any further recurrent infection, as well as some health teaching on antibiotic use, the importance of finishing the entire course, as well as following up if it's not getting better within 48 to 72 hours. And just the use of antibiotics and other medications such as Advil or Tylenol for pain. And also discuss some differentials with her. So some of the differentials that I think that the patient could have was cystitis, sexual transmitted disease, pelvic inflammatory disease, cholecystitis, as well as maybe an obstruction to the bladder or cancer of the bladder as well. And as well, so I do think that the patient does have pyelonephritis. Thank you.